Hi everyone, this is Christy. We're going to be getting started here in a few minutes. If you want to let me know in the chat box if you can hear me, that would be great.
All right, it is a little after 10, so we will go ahead and get started. My name is Gabriella Nyman. My pronouns are she, her, hers, and I am NC CASA's Training and Communication Specialist. I will be helping Christy today monitor the chat box. If you have any questions, please put them into the chat box and we will make sure to get to them. I will now hand it over to Christy, who is our Prevention Education Program Manager. Take it away, Christy.
All right, so I'm hoping you all can hear me. I just unmuted my phone, which I'm using for my audio. I want to thank y'all for joining me this morning, and I'm super excited. We even have people from out of state here with us, so welcome everybody. I'm glad to see you. I also want to give you a heads up that we are going to be going through some prevention information and doing a webinar, but like many of you, I'm doing my work in webinars from home, which means that at some point we may or may not, depending on when the mail comes, be joined by a very loud beagle who I love and welcome her sweet intentions to help, if not the chaos it sometimes creates. So a heads up, we might have a dog join us. The North Carolina Coalition Against Sexual Assault, if you aren't familiar, we're an inclusive statewide alliance working to end sexual violence through education, advocacy, and legislation. We use a social justice framework, and what that means is we try to use a strong intersectional social justice perspective and center our work around marginalized communities, knowing that when we do, that's how everyone gets served. Some of our work is that we organize and sponsor statewide trainings. We provide support and technical assistance and resources to all of North Carolina's rape crisis centers. We do local and national level legislative agenda and policy change. We do a lot of anti-human trafficking outreach and work. We do prevention education, which is my job there, and we also do a lot of campus work with colleges and universities. And we acknowledge when we're talking about gender that not all women are victims, not all men are perpetrators. Anyone of any gender can be a victim, and anyone of any gender can be a perpetrator. And you will see me use throughout this harm doer in place of perpetrator. When I think of perpetration, that's a verb. When I think of a human, I'm thinking of someone who's caused harm. And so for me, perpetrator is a criminal justice framework. Harm doer is a human-based framework. Today, we're going to be doing Sexual Violence Prevention 101. So this is sort of an overview. I see that we have in here some of our RPE subrecipients at our local programs in North Carolina. Many of you are already going to be familiar with a lot of what's in here, but you may hear a few new framings on things. And for some of you, maybe you're in a place where you do a lot of direct services. Maybe you've been an advocate. Maybe you work in some other position in a rape crisis center. And you're curious about what do we mean when we say prevention? And so hopefully today we'll give you some insights into that. My email is there on the slide, christy@nccasa.org. And I always welcome hearing from people who've attended trainings and webinars I've done. So feel free to reach out with any additional questions this comes up, that may come up for you after today's webinar. This is the outline of what we're going to do today. I'd just like to give you a heads up. We're going to talk about what prevention is. We're going to speak a little about evidence and evaluation. We're going to review some best practices in prevention. We're going to talk about how some of that works in practice, and then I'm going to give y'all a chance to ask any questions that you have at the end. So to start with, what is prevention? I always like to remind people, because this is an area where I think if you aren't a preventionist, sometimes people get it wrong, but outreach, awareness, and prevention are not the same thing. Outreach is not prevention. Awareness is not the whole of prevention. The goals of outreach are to let people know about the issue in your agency, your services, in order to reach potential survivors and help connect them to services and resources. The goal of awareness is to make the public aware of the existence, nature, and scope of the problem. So awareness is when we educate people on what the problem is. That's an essential part of prevention, especially if we're in communities or areas or fields in which the issue is not very well understood. But awareness alone is not enough to be prevention, because the goal of prevention is primary prevention of causing or enacting harm against other people. So when in the sexual violence movement we talk about prevention, we're not just talking about letting people know what prevention is. We're not just talking about teaching people how to keep themselves safe. When we talk about prevention and our goal is primary prevention of harm, which means we need to be reducing perpetration of harm. One thing you'll hear us talk about in our models is the social-ecological model, which the CDC educates and trains people on. And the idea with the social-ecological model, first piece of this, is risk factors and protective factors. So risk factors are anything that increase the likelihood of violence occurring, even if they are not causal. Protective factors are things that decrease the likelihood of violence occurring or increase someone's resilience if they experience harm. Something that's important to note about risk factors and protective factors is a lot of times we think about risk factors for experiencing sexual violence and we want to target those. But again, we're looking at primary prevention of causing harm. So we need to also be looking at what are the risk factors for perpetrating sexual violence? What are protective factors for prevention of perpetration of sexual violence? So risk factors can increase the likelihood of causing or experiencing sexual violence, and protective factors decrease the likelihood of causing or experiencing sexual violence. With the social-ecological model, this model that I'm using here has 4 different levels. Depending on where you look for your models, you may see other levels in it, but neatly put, we have individual level, the relationship level, the community level, and the society level. And each of these levels have risk factors at that level and protective factors at that level. Some other levels you may see depending on someone's framework. Someone may include one for school, especially if they're doing trainings in an educational setting. For me, school kind of falls neatly under community because it's a type of community. Same thing with organization. Sometimes when you hear people talk about reducing organizational violence, they'll have that as a separate level. But again, your organization is its own sort of community. So I tend to think of those under community. The reason this is super important when considering violence prevention is that since there are risk factors and protective factors at every level of the social-ecological model, we should be addressing our prevention also at every level of the social-ecological model. So things that they used to do in the past, those of you who are maybe my age might remember hearing this and pushing back against it back when you were in college. Maybe you're still hearing it, and if so, I'm sorry. But you remember carry your keys with your keys shoved through your knuckles, or park near a light, you know, all of these self-protective things, or how to protect yourself from sexual violence. Those are all A, victim blaming, but B, individual level responses. We can't look just at the individual level. Even some healthy things we do around curricula that we use to give students good information about setting boundaries, receiving boundaries, learning about their sexuality. A lot of those still stay at the individual and relationship level, even when they're framed in ways that aren't victim blaming. If we want our prevention work to be comprehensive, we need to be looking at the community. What is it in this community that makes sexual violence more likely to happen? What is it in a community that where a community is deprived of protective factors? What is it at a society level that causes sexual violence to often be unchecked? So if you want a comprehensive prevention program, you need to hit every level of the social-ecological model. So around risk and protective factors, well, yes, Jessica, I saw your chat and you are correct. I am not going to jump into that right at this moment, but yes. So one thing that's important to keep in mind with these risk and protective factors is that we have shared risk and protective factors, which means that because of the way our society is set up, a lot of the things that are risk factors for sexual violence are also risk factors for other forms of violence. A lot of the things that are protective factors for one form of violence are often protective factors for other forms of violence. So a few examples: poor parent-child relationship is a relationship level risk factor for child maltreatment, teen dating violence, intimate partner violence, sexual violence, youth violence, bullying, and suicide. And on the protective end, connection and commitment to school is a relationship level protective factor for teen dating violence, sexual violence, youth violence, bullying, and suicide. Again, societal income inequity is a society level risk factor for child maltreatment, intimate partner violence, youth violence, and bullying. And coordination of resources and services among community agencies is a community level protective factor for child maltreatment, intimate partner violence, suicide, and elder maltreatment. So the reason this comes in helpful if you're doing sexual violence prevention work is you don't have to do it alone. If you reach out with other agencies and coordinate with each other about how you can target these risk and protective factors at different levels of the social-ecological model, your efforts are going to have more impact. You're going to be able to pool resources on campaigns and initiatives, and also, let's look at that last one I just said, coordination of resources and services among community agencies is in fact a community level protective factor. So by connecting the dots, which the CDC document Connecting the Dots, you can download a PDF of and also do an online activity and training around it. Connecting the dots with these risk and protective factors along different forms of violence not only strengthens your program and the impact you're able to have in your community, but it is itself a protective factor at the community level from multiple forms of violence. So some protective factors we know are related to victimization or perpetration of sexual violence, include connection to a caring adult, association with pro-social peers, skills in solving problems non-violently, connection and commitment to school, community support and connectedness, and coordination among community agencies. This is not a comprehensive list, but these are a few that are among the ones included in our state's logic model, where we are working on how we want to have a cohesive strategy in North Carolina. Risk factors, a few risk factors related to victimization or perpetration of sexual violence include rigid adherence to traditional gender norms, lack of nonviolent problem-solving skills, poor neighborhood support and cohesion, community violence, weak community sanctions against sexual violence and harm doers, general tolerance of sexual violence within the community, weak laws and policies related to sexual violence and gender equity, harmful societal norms around masculinity and femininity, and cultural norms that support aggression toward others. Now, I want to, later on in this webinar, we're going to be unpacking a little bit around how did we come up with these risk factors, where did they come from? And there is a webinar I'm doing tomorrow called Upstream Same River, in which we're really going to unpack the social construction of a lot of these risk factors. But I want to point out, for example, community violence often happens in communities that have been historically marginalized and deprived of resources. Weak community sanctions against sexual violence harm doers doesn't only mean weak laws around crime. It's related very much to the next one, which is general tolerance of sexual violence within the community. So keep in mind that a lot of these risk and protective factors don't exist in a vacuum. They exist in a historical and cultural context. Which brings us to another thing you'll hear people talk a lot about in public health prevention, which is the social determinants of health. And what they found is that a lot of times people's health outcomes, to include their experience of violence, whether it's increased or decreased, their risk of violence, has a lot to do with their social environment, which is the built environments in which they live, work, and play. So neighborhood and built environment, health and healthcare, social and community context, access to education, and economic stability are all factors that have an impact and predict risk factors around someone's wellness outcomes. But that brings us to the fact that, again, all of these came out of a certain historical context. And so we need to have hard conversations as an anti-violence movement about why are some neighborhoods in which we know people are at greater risk of experiencing violence. Why do some people have less access to health care and others have more? Why is education so variable in terms of access and quality? These are all questions we can be asking ourselves, which brings us to MC CASA's anti-oppression lens. And it matters. Our anti-oppression lens matters. When we have an anti-oppression lens on our violence prevention, we can give services that are going to be more meaningful and relevant to a wider variety of people. And this is important because youth of color are vastly overrepresented among youth who experience sexual violence and criminalization. Lesbian, gay, and bisexual youth are significantly more likely than their heterosexual peers to experience sexual violence and criminalization. Trans youth are significantly more likely than even their lesbian, gay, and bisexual cisgender peers to experience sexual violence and criminalization. And if we focus our prevention and response programs on one population, we are going to miss opportunities when LGBTQ youth of color do not see their experiences represented or honored in our prevention and response programs. And this is a reminder, people are not inherently vulnerable. Systems make people vulnerable through gaps, deprivation of access, and barriers. I like to remind people, and I'm sure you've probably seen this online, someone's race is not the risk factor for violence. Racism is the risk factor for violence. Someone's orientation is not the risk factor for violence. Homophobia is the risk factor. Keep these distinctions in mind when we talk about marginalized populations. We're not talking, the marginalized to me should say populations that are marginalized by society. People who have been made vulnerable by systems gaps. Keep your language and framing in mind when you're doing your prevention work. And that means we need to be thoughtful about putting our anti-oppression lens into practice. So how are we wording our discussions of vulnerability and risk factors? So I'm going to give y'all a chance. If you want to type some wording reframes into the chat box, you're welcome to do that. But for me, an example that we've talked about some at NC CASA is the idea of poor parenting skills. Sometimes I've heard people refer to poor parenting skills as a risk factor for certain forms of violence. Whereas if we reframe it and say a compromised parent-child relationship, that's less victim blaming. Maybe that parent who we think has poor parenting skills is struggling to be a good parent because they're overwhelmed. They can't access treatment for trauma that they've experienced or mental health treatment. Maybe they can't access substance use treatment. Maybe they are struggling as a parent and can't supervise their child the way they wish they could because they're having to work 3 jobs to make ends meet. So let's think about our wording and how we talk about vulnerability and risk factors in a way that is incorporating our anti-oppression lens. Can y'all think of some risk factors or vulnerabilities that you've heard that maybe you want to offer a reframe on? Feel free to throw any thoughts you have in the chat box. I love learning from people who attend our events. At risk. Ooh, so we're seeing impoverished families. We're seeing at risk. What do we think is going on with at risk? Let's start with at risk. Someone throw something in, throw us some alternative language when we talk about at risk. What's another way of framing that, capturing the essence of what we're getting at in a way that isn't victim blaming, that has an anti-oppression lens? Let's start with at risk. Someone give us an alternative language for that. Anyone? Families who are experiencing difficulties, underserved youth, right? Underserved youth is a good way of representing it, because underserved means we're keeping the focus on our services and how our services aren't reaching them in some ways. I see in here impoverished families. There might be, families with limited access to resources might be another way of doing that. Oppositional behavior, that's a good one. Someone give me a reframe for oppositional behavior. What's a reframe for oppositional behavior? Yeah, because kids who are struggling with oppositional behavior, what we would think of as oppositional behavior, are using the tools that they have. That's a very good point, Tara. So this is just an invitation for you when you're thinking about how you talk about sexual violence in your communities to think very, very carefully at the way you describe the people who are most in need of services and most unable to access them often, you know, or have less access. Think about how you're wording that so that we're not contributing to stigma. Another thing, keeping our ideals into practice with our anti-oppression lens is, are we keeping the focus on perpetration, not on someone's identity, family, community, or orientation? So again, like we mentioned earlier, is someone's race the risk factor, or is racism the risk factor? So let's break it down. So when we talk about somebody give me an example of that. Is there a way that we can talk about keeping the focus on perpetration? Ooh, I like Robin's at-risk. Robin just added on at-risk kids who've been more exposed to harm. Yes. Which also keeps the focus on perpetration because those kids experienced harm. Some things around keeping the focus on perpetration can be, we want to be thoughtful in teaching kids to recognize red flags in unhealthy relationships, but we want to be thoughtful to do it in a way that doesn't suggest that if someone experienced harm, that it's their own fault for not being smart enough or not recognizing the red flags. So a lot of times programs, strategies that are focused on helping people keep themselves safe from harm can be giving good information, but a lot of times it's being framed in a way that suggests if someone experiences harm, it's because they didn't keep themselves safe enough. So making sure we're keeping the focus on perpetration. Recently, I was speaking with my RPE subrecipients about ways to keep youth safer online. How can we talk to youth to keep them safer online? And one of the things that one of our RPE subrecipients brought up is, in addition to trying to talk to your kid about how to stay safe, talk to your kid about how to not be a jerk online. Teach your kid how to not bully someone else. Teach your kid how to not cross someone else's boundaries. Teach your kid to respect someone else's consent. So being focused on teaching not crossing boundaries is just as important as any other information we have to offer, if not more. And then remember, gender neutral language doesn't cost you anything. So a lot of times when you're giving stories and scenarios, you can shift them up and make them gender neutral. You can change them to names that feel a little more gender neutral. You can use they instead of she or he. And again, when you do that inclusive language, you're using names that aren't really identified with one gender or another. You're using they, them pronouns when you're referring to them. And instead of saying their boyfriend, you say their romantic partner or their date mate. When you use that kind of language, what happens is anyone in your audience who's had that experience you're describing can see themselves reflected in the story that you're telling, and it doesn't cause anyone to feel excluded or unseen. Again, gender inclusive instructional settings. Are you teaching in gender separated or gender inclusive settings? One of the things that tends to be true is that LGBTQ youth and frequently LGBTQ adults tend to feel safer sharing and learning and growing with regard to sexuality in LGBTQ specific mixed gender settings than they do in gender segregated settings. So if you have, for example, an adolescent girl who's in an educational program where she's separated out with other girls and hearing a lot of scenarios and talk about what to do with your boyfriend, and everybody else is chiming in and feels like they can relate to it, she's probably feeling pretty isolated and like the information you have isn't for her. So remember, gender neutral language and framings don't cost you anything, and they make it so that people can see themselves reflected in the information you're giving. So the 5 domains of well-being is a model by the Full Frame Initiative, and you can find it a toolkit and lots of training materials about the 5 domains at their website. And it's largely a safety planning model, but I find it really helpful for me to think about in terms of prevention as well. So before I tell you why I like it for prevention, I'm going to tell you a little bit about what the model is. So the 5 domains of well-being model is where there are these 5 areas of life that when people have access to all 5 of them, they experience a greater sense of well-being. And those areas are social connectedness, stability, safety, mastery, and meaningful access to relevant resources. Social connectedness is pretty obvious. That's the degree to which you feel like you have connectedness with family and friends in your community. Stability means the degree to which you're able to predict from one day to the next what your life is going to look like. Safety can include physical and emotional sense of safety. Mastery means that you're able to make a connection between the things that you do and the impact they have on your life. So you feel hungry, you are able to get food, you're not hungry anymore. That is a very small and basic example of mastery. And then meaningful access to relevant resources. And that's the most power-packed few words that I've seen in a long time. But because meaningful and relevant are key there. You can have services in your community, and if the access to them isn't meaningful, they're not accessible, they're not easy for people to get to, they're not affordable, and if they're not relevant for their needs, especially if they come from a specific identity or racial background or orientation, then that's not meaningful access to relevant resources. So when someone has access to all 5 of these, they experience a greater sense of well-being. And where it comes into play in safety planning is that frequently survivors have to sacrifice access to one or more of these domains in order to gain or maintain access to one or more other ones that they prioritize more highly. So someone may sacrifice their stability and their social connectedness. Let's say it's a survivor of domestic violence. They may sacrifice their stability and social connectedness to pick up and leave and go somewhere else and live in another city, maybe in a shelter for a while. Someone may sacrifice their sense of mastery, their ability to make meaningful change in their life, their ability to access meaningful, relevant resources because they're trying to preserve social connectedness that has a great meaning for them, and they don't want to leave their social group. So that's how it's used in safety planning, is helping reduce the number of trade-offs that people have to make in one area to access the other. To me, that makes a lot of sense for prevention as well, because part of our work in prevention as violence preventionists is to try to reduce the trade-offs people have to make in the first place before the violence has happened. How can we provide communities and services and support that help people have access to all 5 of these without having to make trade-offs that leave them vulnerable to violence? So if you want to look at the 5 domains of well-being, you can find it at the Full Frame Initiative's website. So there's an activity I like to do, and because we're in a webinar, you can always, I'm going to have you engage in the chat with the recognition that there's a little bit of a delay. But one of the things I like to get violence preventionists thinking about is the why behind the why behind the why. What is the root cause? So when we look at those risk and protective factors, we can pick one of the risk factor. Say because someone has a lack of nonviolent problem-solving skills, which we know is a risk factor for sexual violence, a lack of nonviolent problem-solving skills. Why does that person have a lack of nonviolent problem-solving skills? Someone give me a guess in the chat box. Because they haven't been exposed to nonviolent problem-solving skills. So basically their parents did not have nonviolent problem-solving skills. Why? Why haven't they been exposed? Why did their parents not have access to nonviolent problem-solving skills? Because, someone just jumped through all 5 of them and went for the gold. That's Julie. And Jen, y'all are giving us good ones. They've been told they need to use aggression or force to show they're strong. Due to having power removed from them systemically and interpersonally, they may have learned that violence is the only way to get to what they need. Cultural acceptance of violent problem solving. And this is where I would ask even another why. Another why, so why was, if we really want to go for cultural acceptance of violent problem solving, we could then ask, why does the culture that they're in accept violent problem solving? And we can track it back from there. With Julia mentioning having power removed from them systemically and interpersonally, we could ask why and start really digging into some of the historical reasons. And we don't want to get too intellectual with this exercise in a way that causes us to lose focus on the people in front of us and the people in our community. But we also want to pull back enough to recognize that none of these people who have these risk and protective factors exist in a vacuum. Every single one of them is existing in a community and a societal context that shaped how they experience violence and how they experience these risk and protective factors. So if thinking through this kind of helps you pull back from some inadvertent victim blaming, it can get you into seeing some of the real root causes, which then shapes what prevention means for us. How do we go after that root cause while also serving the individual? Excuse me, I'm going to talk a little bit about evidence and evaluation now. And I know we hear a lot about evidence-based, and this always makes me laugh. You keep using that word. I do not think it means what you think it means. And I know for people who've been doing RPE programming or maybe have a public health background, evidence-based, you already know it has a very specific meaning. But a lot of times I hear people bounce it around because they're thinking of evidence. Thank you. Tara says, love that meme. Thank you. I made it. I'm very proud of it. I hear people use the phrase evidence-based, and a lot of times they're using it to refer to like, it makes sense, like I'm looking at the community in front of me, and it makes sense. This is clearly supported by the evidence. But in public health and violence prevention, we are talking about something very specific when we say evidence-based, and I want to make sure you all understand what the public health meaning of it is. So there's a few different levels around where someone's practice might be on the evidence. What we call an emerging practice is one that is based on guidelines, protocols, standards, or preferred practice patterns that have been proven to lead to effective public health. It incorporates a process of continual quality improvement, has an evaluation plan in place to measure program outcomes, but it does not yet have evaluation data to demonstrate the effectiveness yet. So an emerging practice is one where we've based it on what we know makes sense and what has been proven to be effective, but we haven't really tested this strategy yet. We're planning to. Promising practice is all of the above, and it has been or is being evaluated, plus it has some strong quantitative and qualitative data showing positive outcomes that doesn't yet have quite enough research or replication to support generalizable positive public health outcomes. And then best practice or evidence-based, there's a rigorous process of peer review and evaluation, and it's been reviewed and substantiated by experts in the public health or education field according to predetermined standards of research. It's replicable and produces desirable results in a variety of settings, and it clearly links positive effects to the program or practice being evaluated and not to other external factors. So when we say evidence-based in violence prevention and public health, we're talking about a pretty complex process that usually involves university researchers researching it. One of the critiques brought up around that is often inaccessible when it comes to strategies and curricula and practices that come out of marginalized communities themselves, that having access to the funding to fund a long study and extensive research is not realistic. So a lot of times, especially when you are looking at stuff that's targeted for specific, by and for specific marginalized communities, you might see that they're an emerging or promising practice, but not yet evidence-based. And a lot of times that's just because it's inaccessible. And you can always download the STOP SV, a technical package to prevent sexual violence. It has a lot of information in there around risk and protective factors and some evidence-based strategies, and it talks about some of the curriculum that might be used to do sexual violence prevention. So we have an amazing logic model that our logic model webinar that our evaluator Anna did recently, and so you can see that at our YouTube channel or in Coalition Manager if you're a member. But one of the evaluation tools that we use is called a logic model. And a logic model is basically, this is a super basic one. What you're seeing, these 5 little boxes here, is a very, very basic logic model. They can be super complicated. They don't have to be for most purposes. So your inputs are the resources, people, time, things that you have to put into your prevention program. You can also use logic models for other areas, for direct services, for certain programs, but we're talking mostly about prevention here. Your activities are what you do with those inputs. Your outputs are the products, and that can include things like number of participants trained, a number of clients served, materials produced, coalitions formed, curricula developed. Your outcomes, short and long term, are culture changes that we're looking for. So with those outcomes, what we're looking for is if we implement our prevention strategy with sufficient saturation, we will see changes in the following knowledge, attitudes, and beliefs and behaviors and skills. So sometimes creating a logic model can be very helpful when planning your prevention strategy. And again, we're talking about how outreach, awareness, and prevention are not the same. We talked about that earlier. The goals of outreach are to reach potential survivors and connect them to services and resources. The goals of awareness are to make the public aware of the existence, nature, and scope of the problem. And the goal of prevention is primary prevention of causing or enacting harm. So the question we have to ask ourselves, and that our logic models can help us clarify, is will your strategies support your goals, and are your goals aligned with your outputs and your outcomes? So looking again at this logic model, if your short and long-term outcomes are the reduction of primary perpetration of sexual violence, then you need to make sure that the activities you do are aligned with preventing primary perpetration, or you're not reaching those outcomes. This is something where we find sometimes you end up doing a whole lot of activities that maybe dance around or are close to prevention, or maybe all of your activities are awareness focused and not prevention focused. And again, awareness can be an important part of prevention, but awareness itself is not prevention. It's not enough. So if all of your activities are awareness, and then your outcomes say that you are hoping to see a reduction in perpetration of sexual violence, then something's not lining up. So this is where a logic model can come in handy, is helping you make sure that you're very clear within yourself, within your agency, about how those activities are going to relate to your outputs and your outcomes. If anyone has any questions on those two things, one, you can type your question in the chat box and we can see if we can answer them here. I know our evaluator is also on the webinar with me today, and we could, Anna could unmute and jump in if there's anything that she wanted to address. You're also welcome to email our evaluator, Anna, at nccasa.org. And if someone would type Anna's email in the chat box for me, that'd be great. But you can also email Anna with any specific questions you have around maybe creating a logic model or checking your logic model if there's pieces you're unclear on yourself. So if you have any questions on that, you can type those in the chat box. And I'm going to take a moment to sip my coffee and try not to inhale it this time, and we'll be right back and keep going. Okay. So we're going to review some best practices. There's a lot of research out there about what works and what doesn't with sexual violence prevention. And prior prevention managers or directors at NC-CASA came up with a list of scouring the literature, what do we find emerge as best practices? And this is the list of all of them. I'm going to go through and address them a little bit one by one. So good prevention is comprehensive. It has multi-component strategies in multiple settings that address a range of risk and protective factors. This is where we start looking at things like, is it addressing different levels of that social-ecological model we talked about earlier? Does it have multiple prongs, multiple ways that you're coming at the issue? Are you addressing a range of risk and protective factors, not just the ones that are the most commonly talked about? Does it use varied teaching methods? So it increases awareness and understanding and enhances and builds new skills. It's interesting and engaging. It reaches a variety of people with different learning styles. This is the one where we find a lot of people struggle in our programs. So I want to emphasize this one, and that's sufficient dosage. Sufficient dosage is important because we know that exposure to enough of the intervention to produce the desired effects has greater impact than spreading our efforts over many audiences. You want to think about saturation. You want to have a smaller audience, fewer audiences, and you want to just really deeply saturate them with good prevention programming. So, for example, if you're trying to reach a whole lot of people and not as worried about sufficient dosage, you might schedule 130-minute presentations with a variety of audiences in your community. And now you have hundreds of people who heard 30 minutes that they're probably going to forget about within a week of attending your presentation. But an example of saturation is, let's say you go into a high school and instead of just doing a one-day session in the auditorium for half an hour, let's say you teach a 6-week course where you come in one day a week for 6 weeks and you work with different students to do some prevention curricula. And let's say in that 6 weeks, you're able to have 100 kids that attend your curricula. And let's say you find that out of that 100 kids who attend your curriculum training, that maybe 15 of them were super engaged and excited and wanted to learn more. And maybe you sponsor starting a youth club. You find a faculty sponsor at the school, and those 15 kids start a consent club at their school. And as part of their consent club activities, whatever you want to call their club, they start making posters and doing their own campaigns and organizing their own events. Then you've made a much bigger impact on the culture and climate at that school than you ever could with a 30-minute presentation. So that's what we mean by sufficient dosage, is to go deeper with your work with people that you're presenting to rather than just casting a broad net and hoping something catches. Good prevention is theory-driven, and that's going to include preventive strategies that have a scientific justification or a logical rationale. Theory is often a basis for developing an approach to intervention that addresses the problem. So again, we were talking earlier about that evidence-based. Even if a practice is not yet evidence-based, if it's driven by theories and have a scientific justification or logical rationale based on what we know has worked with other forms of violence prevention or other efforts at sexual violence prevention, then it's going to be closer to being known to be effective. Good prevention builds positive relationships between children and adults, and they also support the development of positive parent-child relationships. And this is where I want to revisit that anti-oppression practice again, and remembering that families that struggle, it's not okay for them to abuse their kids. And also, we know that those families didn't develop in a vacuum, and that family probably needs some support. So rather than just writing off parent-child relationships where they're struggling and being like, we need other strong adults in their lives, be like, we need other strong adults in their lives, and we want to support parents developing positive relationships with their children so that those children have a benefit of a variety of adults who love them. Appropriately timed. So good prevention is initiated early enough to have an impact on the development of problem behaviors, and they're tailored to the intellectual, cognitive, and social development level of the participants. So having prevention curriculum that is too over the heads of younger people that you're working with is not going to be effective. And at the same time, waiting until kids are already have already formed their ideas around consent and bodies and sexuality is frequently too late to start that dialogue. So start early with age-appropriate conversations to build ideas around consent and bodily autonomy and respect. Good prevention is socio-culturally relevant, so it's going to be tailored to the community and cultural norms, beliefs, and practices. It's going to include the community in planning and implementation. So the best socio-culturally relevant prevention work we've got is prevention work that was developed by and or in partnership with the communities that it's written to support. So culturally specific programming is good, culturally responsive programming is good, but being aware that it's not one size fits all. Good prevention evaluates its outcomes. There's systematic evaluation that documents how well a program has met the goals and objectives. So even if you aren't evidence-based, even if you don't have the luxury of a major university's research programs researching and evaluating what you're doing, you still want to get information. Have a pre and post test. Start out, where's your knowledge now? Start out at the end. How confident do you feel now that we've done this training? Test your knowledge now. See if what you're doing is effective. This is where incorporating evaluation into your logic model can help you continue to hone and shape your logic model and your strategy over time. If you have limited resources and you have 12 things you want to do and you can't do all 12 of them with the resources and time that you have, then evaluating your outcomes will help you see which of the things you want to spend your time on are actually producing the desired outcomes so that you can focus your time and energy and resources on those. And then effective prevention has well-trained staff. So programs are implemented by staff that are sensitive, confident, sufficiently trained, supported, and supervised. It's important to continue with ongoing professional development, to provide booster trainings, and to give technical assistance. Those of you who are in North Carolina, that's what NCCAS is here for. Become one of our member agencies. Like with me, I do prevention. So on the regular basis, I get emails from prevention staff at our local rape crisis centers saying, hey, I'm wanting to do such and such with prevention, and I'm hitting this barrier. Can you help me talk through it? And we have a phone call and we sort through it. So having access to technical assistance on a regular basis is helpful. I see that Tara has a question in there that says, do you have any guidance on how to prioritize who to saturate and reach out to? And I can't really give you a direct answer based on your community or where you are, but I would say there's multiple factors that might steer that decision for me. And if anyone's on the call who has some insight, anyone on the webinar who has some insight to share, please feel free to respond in the chat box on how you prioritize who to saturate and reach out to. But I would say a few things that impact me are looking at my community to see where are the pieces of who in my community is most at risk and sidelined from resources. And then how can I help them have resources to craft and create their own approaches? How can I use my privilege with my agency to help support the initiatives that they know are helpful to them? I think another thing that might play a role in that decision is looking at my staff, looking at who we have on staff, because that might influence hiring decisions. That might help you provide better services and prevention work in the communities you're hoping to provide the most support to. I think that also plays into when you're working in schools. I mean, obviously, the example I gave earlier, we'd want to roll with the 15 kids out of that 100 who couldn't get enough of the programming, are super excited. But two things. One, be aware of how the identity of the person training might influence which 15 feel super excited about it because they feel like they can relate to you. And also making sure that we're supporting the work and initiatives that they're wanting to do so that those 15 students are crafting something that's very youth-driven and youth-led. So I don't know. I don't know that I have an answer. I think it's just a matter of looking at who you have on staff, what your skill sets are, what your identities are, making some tough decisions about if there's someone you need to bring onto staff, looking at your community to see who is most at risk, and again, with those communities, tracking those 5 whys back to figure out what the issues are you should be addressing. And Robin has also added conducting a community assessment to determine this would be helpful. That is excellent. There is a Tri-Ethnic Center has a community readiness assessment for programming that'll help you gain and gather really good information on where your knowledge base in your community is before starting any new programming or shifting direction on it. So all of this has been very much a discussion of principles and frameworks, but we also know that when we actually are doing our prevention, it's people. Oh, you're welcome. When we do our prevention, it's people in communities interacting with other people. So we want to make sure we give you some practice suggestions as well. One of them is to remember that anytime you're talking about sexual health, sexual violence in your communities, you want to do it in a trauma-informed way, because chances are there are people in that audience who have experienced already, before you go in there to talk about prevention, they've already experienced some form of violence, if not sexual violence. Trauma-informed prevention is about starting from the place where you account for and are gentle with someone's trauma moving forward, rather than starting with a standardized strategy and then redirecting once someone expresses trauma. So think about it. If you've got someone, you've got an audience and you know that there's people in there who have had trauma in their past, then you're going to baby step toward them rather than charge ahead and back up only once you've already stepped on someone's toes. What I like about trauma-informed prevention is that it accounts for people's trauma without requiring them to disclose that trauma to you in order to receive trauma-sensitive treatment. And I'm going to say that again, having a trauma-informed prevention accounts for people having trauma in your audience without requiring that they have to disclose that trauma in order to access trauma-sensitive treatment. NC CASA has a whole webinar on trauma-informed prevention. You can find it on our YouTube channel and in Coalition Manager. If you are a member, I did that webinar that gives you a lot. I mean, it's a whole 90 minutes on how to make your prevention work trauma-informed. But trauma-informed prevention is really important because we want people to stay engaged in what we're talking about. And we all know, based on the way trauma triggers work, that if we start out and we bump into somebody's trauma pretty quickly, that we've kind of lost them and they're not able to stay present and listen as much as we would hope they could. We do need to remember, though, as much as we try to be trauma-informed, that everybody we're encountering in our work, they're unique people and they have unique traumas and unique triggers. So the goal with trauma-informed care isn't that nobody is ever triggered by anything we say ever. Otherwise, we wouldn't be able to talk about sexual violence. The goal is to try to anticipate the common ones or the ones we can think about and then do the best we can once we move forward from that. You're going to have people who sometimes are going to get triggered or overwhelmed or maybe even offended by something that you say, and that's a good chance to listen, get the information, support them, and then once you're not with them, make the change, make the repair that you need to make in the way you do your programming to maybe be a little bit broader. But I don't want you to feel like you have to always be walking on eggshells when you're doing this work, because we're all humans. We're all going to make missteps. It's just a matter of anticipating what we think we can anticipate. And being aware, as you're doing your prevention education, you're going to get disclosures. Any of you who have done this work, you already know this. I can't even go to a bar to have a soda and watch a game without someone coming over and, you know, being like, where do you work? And then if I'm in a mood where I tell the truth instead of hiding it, I tell them and they're like, oh, let me tell you about this thing I went through. Anytime people see you as someone who's talking about sexual violence and who seems like a professional and who seems like a good listener and accessible, they're going to want to tell you about the trauma that they went through. And especially when you're doing prevention work. So have a plan before going in. Do you have a distress protocol? And what we mean by distress protocol is, let's say you're giving a presentation in a school and you notice that one of the children in the classroom is starting to cry. What do you do? So have a protocol for that. Who is available in that school during the time that you're there, who that child can go and talk to and debrief with? Is there a counselor, a school social worker? What staff supports are available so that student can step out quietly if they need to, or maybe after the session if they don't want to leave during it, they can get some support. You want to be aware of mandatory reporting laws, and I know some of those have changed recently with minors in North Carolina. NC CASA's webinar also has an excellent our YouTube channel also has an excellent webinar by our staff attorney Sky on SB 199, where you can learn about some of those changes to mandatory reporting in North Carolina. You might want to know, are there safe harbor laws in your state from minor sex trafficking? And there are in North Carolina, which means if that disclosure sounds like domestic minor sex trafficking or some sort of child sexual exploitation, that there are laws that protect that child from the consequences of any criminal behavior they were forced to engage in as part of their trafficking. You're also going to want to know what your community and local resources are. I know my supervisor, our Associate Director, Robin Colbert, is on, and Robin will not present anywhere if they don't have community and local resources to help support people when they do get something kicked up by the prevention work that we're doing. So at every event you speak at, every school you go in, make sure that in addition to having a distress protocol in place, that you have a list of community resources. Who's the local rape crisis center? Who's the local domestic violence center? What other supports are there in this community, so that you can leave people with those supports and say, hey, I just came into your community today to do this event. Maybe it's an ongoing event, you have a relationship with them. But either way, I'm here today and I'm going to be leaving in the next 20 minutes, but I want to leave you with this list so that if some stuff comes up for you that's hard for you to process, you know who you can reach out to and have that support. That's just good ethics. Make sure you know where the community and local resources are. Let me check my time. Okay, so I want to talk to you about some creative sexual assault and domestic violence prevention strategies that are in use, many of these by our subrecipients, but I want to get you thinking creatively beyond just the, the individual self-defense models of prevention. So one of them that's in a curricula called Shifting Boundaries is called hotspot mapping. And what you do with the hotspot mapping is, after giving students some lessons where you talk about boundaries, what a boundary is, what a boundary violation looks like, they then have a map of their school. And it has the classrooms, it includes the bus, it includes the lunchroom, and they get to color in that map with either red, yellow, or green. And green means that it's somewhere that feels safe to them. Red is somewhere that feels very unsafe to them, that things have happened. They color it in, and you have each student color in one, and then you come back and aggregate it to create a hotspot that shows what are the areas of the school that are typically seen as feeling safer, what are the areas of the school that are typically seen as feeling less safe. And then you present that to the administration to let them know, here are the areas. Is it that it's a stairwell that doesn't have good lighting in it, that's sort of dark and off, maybe just even changing the lighting in different spots can help them feel safer. You can make choices around keeping the school safer by presenting that aggregated data to the school administrator. One of the things that's cool about this is, what level of the social-ecological model is this targeting? Yeah, we're hitting right at community. Another one in Safe Dates has a poster campaign where you have students create their own poster campaign to promote awareness and prevention around sexual violence. You could even combine hotspot mapping and a student-led poster campaign by putting those posters in the areas that are seen to feel less safe as reminders, right? And again, that's a community level strategy. Supporting student groups and student advocacy. I know we mentioned earlier, I know several of our RPE subrecipients have in their county started a student group for like Youth Against Rape Culture, or some other related group where you're engaging students in their own advocacy and organizing around this and creating student leaders. I know NC CASA has every summer our Young Advocates Institute, where we are training young people to be advocates and do this work on their own. And again, by creating student groups, not only are you hitting those students with individual and relationship level support, but you're empowering those students to do community and society level change. And that's what we're going for, is those community and society level approaches that often get overlooked. Social media campaigns. Again, who's the population you're working with? Have them create the social media campaign and you just provide backup and guidance. That again, we're hitting at community and society level culture shifts. community task forces based on shared risk and protective factors. And I'm mentioning IFNC. Oops, went ahead. I'm mentioning IFNC, which is Injury Free North Carolina, and that's a collaboration between the Division of Public Health's Injury Prevention and the Injury Prevention Research Center at UNC. So IFNC is where they bring together teams from different communities, and each team has people from different fields. So it might have someone from a local rape crisis center, someone from a local child abuse prevention program, someone from a local homelessness agency, someone from the local DV agency, and someone from the local schools who maybe works at Head Start. And you have them come together and start talking about initiatives and actions they can do based on the shared risk and protective factors between the different issues they're addressing, so that they can start to make community-wide changes that help reduce violence. Other creative strategies include reaching people in the communities, so bar outreach. How do you go in and train bartenders and bar staff and restaurant staff to do bystander intervention? How do you get messaging and materials into those bars that help shift the culture in those areas? We have one of our RPE subrecipients who's done an amazing barbershop outreach, knowing that barber shops in communities can be like a community hub and a social place, just like we've seen people do them with hair salons. Give the people who work in there training and information about the dynamics of power and control and how to discuss it and how to do bystander intervention. Other forms of creative community prevention. I've even done some creative prevention work in the partner dance community that I'm part of. So anywhere that you see communities, there's opportunities for shifting community narratives around violence and consent. And throughout all of these creative strategies, these are just to give you a sampling, but you can get creative in your work and think about multiple layers of the social-ecological model. What is the community you're working within? And how can you create community and society level change to prevent violence? So get out of the box thinking is good. Haha, which I did not know that was the first line on my next slide. So think out of the box. And this is related to COVID-19 and prevention. And this is something where ever since the pandemic started, we've been having regular prevention calls for our RPE subrecipient agencies, prevention teams to come together and share with each other about how do we do this during a pandemic? How do we do this when schools aren't in session, when we have social distancing, when things are all disrupted? So you got to get creative. You have to think out of the box. So one of the solutions that we've come up with on our support calls is to connect the dots between multiple forms of violence, to include systemic violence, racism, and other forms of oppression. And so remembering that 5 whys activity, and those discussions we had earlier in the webinar about reframing our risk and protective factors. When we connect the dots really thoroughly, we start to see that some of the things we do that maybe don't on the surface look like sexual violence prevention actually reduce sexual violence. So helping people feel supported, helping people, because we know violence escalates during time, because if it's about power and control, it escalates during times when people feel powerless and out of control. So what can we do to help people in our communities manage their own triggers, manage their own sense of overwhelm and stress? How can we support families with income and food access and all the things that help them feel less overwhelmed and less stressed and less pressured and less out of control, so that they're less likely to enact power and control against other people in their lives. Promoting wellness, coping strategies, and managing triggers and overwhelm. That's kind of what we just talked about. That relates to this reduction in violence. We're reaching people in ways that cross disciplines in our community to help provide a net of support to people who are struggling to survive right now. Another way is online campaigns. Social media and video-based classes. So a lot of our RTE subrecipients have been doing Facebook and Instagram Lives. They've been doing video-based classes. We have one that's starting like a series of video-based curricula for young people. A few cautions with that, the reasons that I have the star there. One of them is to remember that not everybody in your community has access to the internet. Therefore, when you do online-only campaigns, you are not reaching some of the most marginalized people in your community who likely need that support the most. It's still good, still do your online campaigns, but don't feel like that's reaching everybody. And then the other caveat with that is remembering, especially with young people, that when you do online learning, you are talking to youth who may or may not be in a supportive home environment about really tricky, traumatic stuff. And especially if they're in a home environment with someone who has caused harm, has abused them, has assaulted them, that information being given to them in a space where they may or may not have access to the supports they need to process what they're hearing should at least cause you to think really thoughtfully about how you word the information that you're giving people. And then the last box here is something that some of our RPE sub-recipients have been doing to try to reach people who aren't able to access online information. So coming up with materials that get sent, if your school district's sending lunches home with, doing a lunch pickup once a week or however often, see if you can get a flyer or some materials sent home in those lunch boxes. And again, those materials you put in might be going home to students, but might not be materials for the student. Maybe you're giving parents a brochure that talks about wellness and coping strategies and managing triggers and overwhelm. Maybe it's not all just about sexual violence. Maybe in addition to talking about some of your protective factors and the risk factors for sexual violence, maybe you also on the back have a list of places to get extra support around housing insecurity and where to get more food and how to pay rent if they're coming up short, who can help them with rent relief. So just because you're sending materials home in lunches doesn't mean that material is necessarily targeted at the young people. Maybe you're having materials that are going into the break rooms of essential workers or into community shared spaces. And I know with a lot of this, many of our communities are starting to open back up, but we all also are aware that if we see another second spike in cases that we may see things close back down some. So all of this is still relevant. One of the models that I saw, I know that Our Voice did a really interesting model, which is they sent flyers home. They had an English flyer and they had a Spanish flyer. And on the front of the flyer, it tended to hit more of the direct service issues. So here's a hotline if you're feeling unsafe. Here's the rape crisis hotline. Here's the DV hotline. Here's where you can reach to get support. No one deserves to be abused or harmed. You flip it over and the backside is prevention. So here are some things you can do to manage your stress and overwhelm during this time. Kind of focused on wellness. So get creative. We can still reach people. We just have to be thoughtful about how we're doing it and very creative. And you can still even collect data on some of this. How many materials did you send home with people? How many break rooms did you get materials in? And do you know how many staff they have there? How many viewers were at your Facebook Live? How many Facebook Lives did you do? How many, so you can still track some data. It may not be the data that your funders are used to seeing, but you can at least still show, hey, even during COVID and during reduced access, we got creative and here's what we were able to do, and then track it in some way that shows at least the reach and effort. So questions. If you have any questions, you can go ahead and throw those in the chat box now. And maybe a talking point, if you don't have a question, is there something that you heard today that maybe, what might you want to change in your prevention program based on what you heard today? Or did you have an aha moment you want to share, or a light bulb moment you want to share with us? I love getting feedback. So if you got something useful today that you want to share, I would love to hear about it. Okay. Well, I'll talk for a second so that if anyone's typing their comment or question, you can add that in there. But I know Gabriella just posted the links to the rest of the Powerful Prevention webinar series. We've done the Logic Model 101, This is our Prevention 101, which we're going to have a repeat of in early July. We also have one on trauma-informed prevention we're going to be repeating. We have one that's going to be an overview of different curricula that are out there. And then there's going to be one that's on evaluation for program success. And then tomorrow, this isn't part of our Powerful Prevention series, but I want to strongly encourage anyone who found the discussion today about an anti-oppression lens interesting and wants to go a little deeper with it. Tomorrow's a webinar where we're going to take that and go a lot deeper. I do see a comment from someone saying, I loved the emphasis on community prevention in areas that you wouldn't necessarily connect to sexual assault, and how important it is to target and educate all the youth. Yeah, you know, and I'm going to be honest and say that every single thing I do, I'm learning right alongside all of you. And so our RPE subrecipients are a pack of just brilliant, creative preventionists. And those brainstorms that they have had around how to shift in the time of COVID have been very instructive and enlightening for all of us, I think. The social-ecological model is a great reminder that this is very complex and we need to address sexual violence from several angles, and it's a nice practical tool for thinking through that complexity. Thank you. Okay, well, I am going to put my contact info. Don't use that phone number. That phone number will get you to our office, which will get an email sent to me to let me know to return your call. But you can go ahead and bypass that and send me an email directly if you want, Christy@ncasa.org, with any questions that you might have or comments. And thank you so much. It's been great and an honor to have some time with you today. Keep doing the good work, y'all. Bye.